So can I have laser eye surgery with dry eyes? Well, the answer is it depends. It depends on the degree of dry eye. So I do encounter some patients who at assessment find they have really incredibly severe dry eye despite not wearing contact lenses and despite appropriate behaviour modifications and use of lubricants. And so really in that situation, I wouldn't undertake corneal laser eye surgery. We know that laser eye surgery causes a temporary increase in dry eye symptoms. Typically this lasts about 3 to 6 months. And it results because we're interrupting the nerves at the front of the cornea. And that reduction in sensation results in a reduction in tear production. Now, the nerves recover, the nerves do grow back, and the sensation returns to normal. And when it does, the tear production will also return. But if you have a patient with very severe dry eye, they're going to have a rough time for a few months afterwards, and I would counsel them against it. So it's actually rare to have a patient whose eyes are so dry that we can't perform laser eye surgery. For most people, the dryness is a result of wearing contact lenses and staring too much at screens in air-conditioned offices. Well, we can improve those things. So with a period of time not wearing contact lenses, using lubricants, changing behaviours, we can improve their ocular surface to a point where they are fit for laser eye surgery. We then manage them through the post-operative period with increased topical lubrication, increased artificial tears, until the corneas have recovered. The nerves have grown back in, sensations back to normal, and the functions back to normal. Moreover, we now have access to SMILE keyhole laser eye surgery. And using this approach to laser eye surgery to treat short-sightedness, we can have less effect on dry eye. So with SMILE laser eye surgery, we're placing the incisions lower down in the cornea so they have less effect on the nerves, and we're only using a tiny keyhole incision, so again, less effect on the nerves. What this means is that corneal sensation returns to normal after only about 3 months instead of the 6 months required after LASIK. And so after LASIK or indeed SMILE, we can manage those patients through until the tear film returns to normal, and then there's a win from these patients not wearing contact lenses anymore, because we know that contact lens wear causes dry eye. And so actually many of these patients can look forward to having improved dry eye symptoms long term after they've had their laser eye surgery.